In this video, I'd like to set the stage for the first part of the course on the three fundamental concepts of healthcare: cost, quality, and access, as well as how the Affordable Care Act is affecting those concepts. Knowing a bit about the historical context regarding healthcare reform is very helpful in giving us an appreciation for the current state of our healthcare system. Before the Affordable Care Act became law in 2010, the campaign for some degree of universal government-funded healthcare in the U.S. began over a century ago, and there were several occasions on which it could have actually happened, but always resulted in defeat. Looking at the progression of these various efforts and why they failed provides us some insight into why the U.S. remains one of the very few developed countries without a single-payer system of healthcare coverage. Other developed countries have had some form of nationalized medicine or national health insurance for almost as long as the U.S. has been trying to get it. Germany began a system for its labor force in 1883. By 1912, Austria, Hungary, Norway, Britain, Russia, the Netherlands, Sweden, Denmark, France, and Switzerland all had some form of universal health care coverage, or at least the beginnings of it. The primary reason for the emergence of those programs in Europe was to stabilize income and to protect against wage loss. Interestingly, the British and German systems were actually developed by the more conservative wings of the government, and they were intended originally as a way of countering the expansion of the socialist and labor parties. They saw insurance against the cost of sickness as a way of turning benevolence into power, a phrase that originated with Princeton sociologist Paul Starr. During that same era, the American approach to healthcare was simply not to do anything and for the federal government to leave matters of healthcare to the states, which in turn left healthcare coverage to private insurance programs. The U.S. had no public programs for health coverage through the early 20th century. However, during that time, labor activists were trying to improve conditions for workers, but not with enough support for the type of broad social insurance that we saw coming out of Europe. Teddy Roosevelt, a Republican who was president from 1901 to 1909, supported the notion of national health insurance as a way of ensuring a strong and healthy workforce. Nonetheless, for decades thereafter, most of the initiative for reform took place in the private sector. There was one notable attempt in this era at providing the American labor force with health insurance. In 1915, an organization called the American Association of Labor Legislation, or AALL, presented a model of health insurance bill that would have limited coverage to the working class and the poor for physician and hospital care, as well as sick pay, maternity benefits, and a death benefit of $50 to pay for funeral expenses. The AALL's main mission was to do away with capitalism rather than to reform it. That organization teamed up with the American Medical Association, the AMA, an organization not known historically as being a proponent of national coverage. By 1917, it became clear that many state medical societies opposed the idea of compulsory health insurance, and the AMA began backpedaling and eventually distanced itself entirely from the AALL. Meanwhile, the American Federation of Labor, the AFL, repeatedly denounced compulsory health insurance as an unnecessary and paternalistic reform that would create a system of state supervision over people's health. The AFL was concerned that a government-based insurance system would weaken unions, whose role it was to provide social benefits to its members. The private commercial insurance industry also opposed efforts to nationalize health care in the early 20th century. One very interesting and seemingly minor social factor played an important role in efforts to expand healthcare coverage. The working class and the poor were very afraid of the possibility of a pauper's burial, so the main feature of many health insurance policies at the time for working class families was a death benefit that covered funeral expenses. So it seemed to make sense to progressives and to reformers to ensure that a funeral benefit should be included in proposals for health insurance. But this created a big conflict with private life insurance companies, which were selling life insurance policies that included a burial benefit. The commercial health insurance industry's inclusion of a death benefit turned out to be a strategic error because it threatened and undermined the commercial life insurance industry. What else was going on in the early 20th century? Well, in 1917, the U.S. entered World War I, and anti-German sentiment in the U.S. became very fierce. Because the German government was socialist, everything about socialism became anathema. The U.S. government denounced such ideas as German socialist insurance and as Prussian menace, inconsistent with American values. Other efforts at state-level reform did crop up around this time, including those in California, New York, Ohio, Pennsylvania, and Illinois, But in the Red Scare era after the war, opponents of such efforts were successful in branding them as radical and as being associated with Bolshevism. So the issue died on the vine and didn't come up again with any significance, at least until the 1930s. Leading up to the 30s, a philanthropically funded group of economists, physicians, and public health officials that called itself the Committee on the Cost of Medical Care funded a large study of healthcare issues in the 1930s. CCMC determined that there was a need for more medical care for everyone. The organization recommended that insurance coverage remain voluntary, but it called for heavy subsidies from the government, which not surprisingly met wide disapproval from the conservatives and from the AMA. By the 30s, medical costs had increased substantially, and this became the main issue because workers could not afford coverage. And that was viewed as the bigger problem compared to the one of lost wages from illness. Then came Franklin Roosevelt, FDR, in whose long tenure from 1933 to 1945 can be characterized by the aftermath of the Great Depression, World War II, and the New Deal, including the Social Security Bill. You might intuitively think that the Depression would have caused Americans to want compulsory government-funded health insurance, but unemployment became the bigger concern, and the AMA's opposition to health coverage kept it out of the New Deal. Social Security legislation, however, got through a second period some refer to as the Second New Deal. Another attempt at national coverage was the Wagner National Health Act of 1939, but the timing of the act was not ideal. In the 1938 election, there was a resurgence of conservatism, and the movement for national health insurance in the late 1930s also faced a still weak economy. But proponents of the legislation kept it alive, and in the 40s, the Wagner Bill evolved into the Wagner-Murray-Dingell Bill, which called for compulsory national health insurance and a payroll tax. But it faced huge opposition, including scathing attacks, making the legislation out to be communist. Despite being introduced in Congress for 14 consecutive years, the bill never passed. After FDR died, Harry Truman became president from 1945 to 1953, in the era of the early Cold War and of continued fear of communism. Truman supported nationalized health insurance, but the opposition, which included the AMA, the American Hospital Association, and the American Bar Association, was successful in associating that legislation with the Cold War and with communism, by, among other things, characterizing those efforts as socialized medicine, during a time when anything socialist was generally viewed as evil. In 1946, the Republicans took control of Congress and had no interest in enacting national health insurance, and they continued characterizing it as a socialist scheme. After he won re-election in 1948, President Truman pushed again for a national health bill, but the AMA felt so threatened by it, the organization assessed their members an extra $25 each to resist national health insurance, and they spent $1.5 million on the anti-national health efforts, which at the time was the most expensive lobbying effort in American history. So not unexpectedly, Truman's plan died in a congressional committee. However, despite the adverse atmosphere, advocates of health insurance decided to attempt a smaller change to previously proposed national health insurance efforts and started proposing more modest options, which eventually turned into Medicare, a program for the older segment of our population. Reform advocates began feeling optimistic and grateful when, in 1958, Congress began considering a national health insurance program for older Americans. But it took another 7 years up against continued massive opposition by the AMA before President Johnson signed Medicare into law in 1965. Efforts at a more expansive national health program for everyone did not reappear until President Bill Clinton's election in 1993. The president's wife, Hillary Clinton, led the task force that devised the plan. As we know, that effort failed, and it was not until President Obama's reign in which Congress was able to narrowly pass the Patient Protection and Affordable Care Act. With that overview of the historical context, we will next begin looking more closely at the three fundamental concepts of the iron triangle of healthcare: cost, quality, and access. It is through those three lenses that we will examine and analyze the specific doctrines in healthcare law.